Hi guys, so I wanted to do a video on the topic of not feeling like a nurse because I feel like as students and as new grad nurses, that is definitely a feeling or thought that you come across as a student or new grad nurse, that you don't feel like a nurse. Like, you don't feel like, are you even cut out for this? Can I even do this? I don't feel like I know enough. And I wanted to talk about how I felt and that feeling for me, and also talk about how I'm feeling now. One second. There's a guy out there. What's he doing? What the heck? That was interesting. Anyways, when I started working as a nurse, I definitely did not feel like I was a nurse, at least for the first few weeks. Even when patients ask simple things like, when does the doctor come by in the morning? Or what do I do about this bandage on my leg? Or I don't know, just like general questions that I just like didn't know the answers to from not being a nurse and like not working at that hospital. I just felt like I didn't even know it. I didn't know enough. I didn't know anything to like really truly give my patients 100% of the care they needed. Like, yes, could I do medications? Could I assess? Could I talk about how they're feeling, how they're doing? Could I make sure their fluids are running? Could I start an IV? Could I do a catheter? Like, yes, I could do all those tasky things. But when it came to certain questions about maybe a symptom the patient was having that I had never heard of, or a medication that they had that I had never heard of, and maybe they asked me a specific question about it that I didn't know, and I just felt kind of lost and like I'm not like a real nurse. Like, I don't know these things, and real nurses know these things. And it was frustrating for me, but I can say now that I feel like a nurse now. I can tell people, like when people ask me, you know, what do you do? What's your job? And I say, oh, I'm a nurse. Like, I truly mean it now. And when I first got my RN license, before I actually started a job, and people said, like, what do you do? And I would say, like, oh, I'm gonna become a nurse. Even though I had my license, like, I technically was an RN, I just didn't feel like a nurse. My husband would say all the time, like, you're a nurse, you're a nurse. I'm like, no, I'm not a nurse till I get my license, and then I'm got a job that I've been working at for a couple months, and then I'll feel like a nurse. And now I am feeling like a nurse. I feel like I have the flow of things down. I don't know everything. I'm not making this video to, tell you guys that I know everything there is to know, because there's so much that I don't know. But I finally feel like I am just grasping things and can answer patients' questions. And I've learned that patients are okay with you saying, that's a good question. I am not sure about that medication side effect of dizziness that you're maybe explaining to me, but let me look it up and see, and let me talk with another nurse to see their thoughts on it. And patients are okay with you saying that. And at first I felt like I need to know everything. I need to know like how to answer my patient's questions. And if a patient has a question about maybe a diagnosis or something that I don't know, I am okay with saying, you know what? I haven't heard of that before, but let me go look it up. Let me talk with someone and I'll let you know. And patients would so much rather hear that than something that is a lie, or you just telling them that you don't know, because you don't want them to think that you're incompetent or taking care of them, but it's okay to not know everything. So if you guys are feeling like you are not a nurse, that you are not quite there to feeling like you fit the role of being a nurse, don't worry, you'll get there. That's normal. And I don't want you to think that you're not a nurse if you have your license, or you're a student nurse. Like, you're gonna get there, and you are a nurse, or you're going to be a nurse, and that is going to be your role, and you will fill those shoes, you will do great at it, and you will feel like a nurse. Okay guys, I hope you enjoyed this video. Leave some comments in the comments below on how you are feeling right now in this moment about your nursing life, whether you're a student or a student to be, or you have graduated recently, or you've been a nurse for a long time. Tell me how you feel. Thank you guys for watching this video. Give it a thumbs up and subscribe to my channel, and I'll see you next time. Bye.